Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be.
Welcome, everyone. You have arrived at the Health In Show, January 19th, 2015. It is Martin Luther King Jr.'s celebration in honor of his great works, and I don't have a quote from him today, but I do say that let's all dream for a better world, communicating in the most positive way possible. And we're going to be talking about communicable disease, influenza, in this season 2015. So I'm sending out waves of awareness and lots of love and hope to all of us, and thank you for being with me today. We're going to start with, I want to first thank Amnon for being the producer of the show and
No, thank you for doing the show.
Yes, it's been a while since I've been in the studio, and so I'm going to share some things with you. Starting off, the first slide, it says, "The soil is the great connector of our lives, the source and destination of all," quote by Wendell Berry. And we are the soil. Our bodies are the soil. We are connected to every single thing on this planet. The air we breathe, the things we touch, what we smell, just all using all of our senses. Our skin is a barrier and a protector, but it is also what we are in touch with. Other people when we give hugs. Yesterday I saw a video, an incredible video of a man who stood out in a street in Australia and just stood there, open arms with a blindfold on. And he said, I am in a state of trust and I want hugs. And then you just saw for 5 minutes straight people in the street coming up and giving him a warm hug. And I can't imagine how marvelous he felt after that. I was also thinking about communicable disease, and I bet he didn't get sick at all. So today's show is about influenza and alternative solutions. The shows are for educational purposes only. Please see your physician, your healthcare provider, if you are in need of specific help. And then I want to start today with the universal truth about the mind, the body, and the soul. And that is on slide 2. To keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. That is a quote from Buddha. And for myself, I am working on keeping my mind strong and clear. Like I say at the very beginning of each show, that is what we are thinking. It is, if we're thinking negative thoughts or sad, we can easily dive down into depression, and that affects our health immensely. So we need to boost ourselves with not only the sunlight outside, but the sunshine inside, our positive thoughts, and getting the support of other people around us who also send us positive healing thoughts. The second quote I have is, "The body is your temple. Keep it pure and clean for the soul to reside in." That's BKS Iyengar, a great yoga teacher. And he is telling us what all of the sages say, that our body is our vessel that our soul is poured into, is breathed into by the Creator. And for a beautiful home, we need to take care of our body. If we go to slide number 3, I was told by my counselor, my special counselor during healing, that it's important to share your humanity. And that means really being with other people fully, being present, listening to each other, and communicating who we are, what we know, our personal experiences, the wisdom that we have innately, our gifts, and our compassion. So today I wanted to start the program with a message that Dr. Pawan Parikh, who is my personal homeopath, he told me over and over again, do your 30 minutes of pranayama breathing every day. And I am starting this practice. I wanted to share it with you, and I know a lot of you probably already do it. However, this is a quote from Krishna Makarya. It says, inhale and God approaches you. Hold the inhalation and God remains with you. Exhale and you approach God. Hold the exhalation and surrender to God. So what we're going to be doing, and I will demonstrate this before we go into the data of influenza, what we're going to do is be mindful, relax our body, and we use our hand. And there's different hand mudras or positions, whether you fold the first two fingers or the second two fingers in when you're holding the position on your nose, on the nasal passages to close, or possibly even this mudra. There's different ones, whatever you're comfortable with, or just all of your fingers. And what you do is I use my right hand, whatever you're comfortable with. You close the nostril on one side. I start closing on my right. And then I start with my thumb on my right nostril. And then I inhale into my right. I close with my fingers, both nostrils, to hold the breath in. And then I release the thumb on the right side and exhale. Then after the exhale, you're going to need to inhale again, close and hold, and then on the left side, exhale. And so it's this cycle of breathing, inhale, and you might do a count. There are different counts for different ways of getting the energy into your brain, into your lungs, your abdomen, your heart, all of your organs. You want to breathe as deeply as you can. And when you do this, you're just relaxing completely and opening to the energy, to the knowledge that oxygen is so important for life. And so I usually do a count of 8 of inhale, 8 of hold, and 8 of exhale. It might be too much for some people. Maybe 8 is too much. Maybe 4 or 7 or 6 is all that you can do. And you might have 8 inhale, hold for 4, and exhale 8, something like that. So I'm going to start, and I'm going to, hopefully you're going to do it with me. Okay, I don't know if you can hear that. Okay, so I'm going to hold my right nostril down and inhale. Sorry about that. It gets confusing when you're trying to explain it. Close the left side and inhale right. Hold. Exhale on the left. Inhale on the left. Hold. Exhale on the right. Inhale on the right. exhale on the left. And we just did one cycle. I don't know whether you followed along. I hope that you did, and you could see how it puts you into a quiet, relaxed, meditative state so that you release any anxiety and fear, because those are also potent elements of staying well, releasing fear. So I'm going to go ahead now, and I see Dr. Bob was doing Om with me. And I want to thank, I see Dr. Kuboshan is here, Vera, Giza, Rhonda, Dr. Bob, Michelle, and Kavitha, and Dr. Wakwar. Okay, thanks. Hello, and thanks for being with me. Now we're going to get into the information that's being given to us, not the information that we're giving to ourselves. The information we're giving to ourselves is love and healing and good thoughts. Okay, so what we hear on the news is slide number 4, that people are dying of infections like bronchitis and pneumonia, even though they're telling us that they calculate how many flu deaths there are. But it is not really the death from flu. It is the secondary infections from people who already have weakened, compromised immune system, people who have chronic disease, asthma, and they constantly get ear infections, sinus infections, cold, respiratory illness, or even other metabolic syndromes or immune dysfunctions. So the CDC website states commonly that it is accepted and reported that 36,000, and that's Americans only, not worldwide, die from flu. And influenza and pneumonia is the 7th leading cause of death in the United States. But why are flu and pneumonia bundled together? And I'm just giving you a reference point here that on the National Institutes of Health website, there's an article called, "Are U.S. Flu Deaths Figures More PR Than Science?" And this is by Peter Doshi. And then there's a couple of other links on that slide that tell you about flu, about disease, about the stats, and what information we're really getting. So in actuality, each flu season, there could be anywhere from 3,000 to maybe 49 or 45,000 deaths in the United States only. But we're just getting this general average that they're talking about. And that average may also not be actually from flu. It could be from the pneumonia or the secondary infection. Very few people die directly from flu. Slide number 5. Miasmatic disease tendency, secondary infection in a weakened body. So in homeopathy, we talk about hereditary miasms, just areas of the body and organs of the body that are susceptible to disease based on our hereditary. Some people have a problem with their bowels, some people with their bones, and some people with their lungs. It's all in your family predisposition. I'm giving a quote from Dr. Boricki regarding SORA, regarding the treatment of disease in children. It says, "Often the disease tendency develops as a sequel to pertussis, measles, gripe," and you could put in influenza in there, and it is the treatment of these acute diseases, and especially in their convalescence, that an anti-soric remedies should be permanent. That means that he believes that there are homeopathic remedies that will negate will overcome your predisposition to coming down, your sensitivities to coming down with these diseases. Okay, the slide number 6. Dr. Hahnemann talks about contagious respiratory illness. This is a continuation of the previous slide. The fact is that bacilli may indeed find lodgment, for there are tuberculizable, and that means tuberculosis, lung respiratory infection under special favoring circumstances. But unless the conditions for the growth and the development are favorable by the presence of sora or your predisposition, which prepares the germs a suitable soil, and that's exactly why I started my show today with "We are the soil," the growth remains local and tends to heal spontaneously. So yes, you get the flu and you get over it. Antisoric treatment changes the soil and secures immunity. So he's saying with the proper treatment of homeopathic care, you can boost the soil, you can boost your body, you can boost the way that you handle contagious disease. Slide number 7. And if you have a question, you can put it in the chat. If you have a comment, I'll look at it there. Susceptibility to contagious disease due to environmental and lifestyle. This is a continuation of the previous slide. It says susceptibility and reaction to the soric miasmatic contagion will depend on, quote, the bodily constitution of a man or woman, his hereditary disposition, the various errors in his education and habits, his manners of living and diet, his employments, his turn of mind, his morality, etc. And this comes from Dr. Samuel Hahnemann's Chronic Diseases in Volume 1. So he's telling us, he's laying the groundwork for us to understand why it is that we might be so susceptible to illness. So basically our heredity, but also what are you doing in your life? What is in your mind? What is around you? Who are your friends? What are you drinking all the time? Are you smoking? Are you challenging your lungs to begin with, and your liver and your kidney? What are you doing to boost your energy? We're going to talk about that. Slide number 8. The impact of lifestyle behaviors on the acquisition of pandemic, and this was from H1N1, the flu that we had in, I think it was 2009, influenza infection. There was a NIH study that said in the conclusion to that article, a current smoking status and a history of frequent colds were associated with an increased risk of acquiring H1N1 infection. So you see the groundwork of a person, how they care for their body, their lifestyle, and the chronic condition of frequent colds and susceptibility is what increased their risk of acquiring this disease. So in 2015, we have this seasonal viral strain H3N2. I keep pushing my hair the wrong way, one way or the other. Okay, the next slide, number 9, influenza is widespread. This is an article in the paper January 7, 2015, which is just 1 week ago, from Loyola University Health System. The CDC, Centers for Disease Control, reports that flu activity is high or widespread in 43 states and call it an epidemic this season. Most of the cases are caused by the H3N2 strain. We're not going to go into today what is the requirements for labeling a disease an epidemic at an epidemic proportion or a pandemic proportion. But I think that they use the word frequently when maybe in past history it wasn't labeled it. I mean, I know a lot of people have been sick, and I know a lot of people have had the secondary infections of bronchitis and pneumonia, but they are getting well, and I think there's probably pockets of people in different areas. And so this is the information that we're being told every day, and they also tell us to get a vaccine. We're going to get into that later. Slide number 10. Initial emotional response. You hear about it. Your friends are calling in sick. They tell you that they have pneumonia. And I've gotten calls. You've gotten calls too, Amnon. And there's a lot of anxiety. I remember in 2009 when the H1N1, the bird flu, hit, and I really was anxious. I was going to go on an airplane to fly to New York, And I had a lot of anxiety. You know, people were wearing masks at that time and all sorts of things. So this is the remedy that I took. I took gelsemium, and it's probably just a great remedy for me to begin with. But think about it at your initial stage of you haven't come in contact with anybody yet, or maybe you even have come in contact by going in the grocery store and touching the handle on the grocery cart or doorknobs or whatever you've done, and you're really anxious about it. Well, here's the symptoms: dizzy, dull, and drowsy. D. You have a lot of anticipation, but you don't feel sick yet, but you just have this gradual feeling that you don't feel well, and the sensation of heaviness, droopy eyelids, and it gets worse and worse. More fatigue, restlessness, chills up and down the spine. You have, you don't like a draft, and you might be starting a headache, a lot of sneezing, and a dry sensation in the nose, despite the fact that you do have some irritating, watery nasal discharge. So you also feel better with motion and open air if you're not chilled, and you're worse from damp weather. One of the things that I didn't list in this is when you are in the throes of this flu, when you go to urinate, you actually feel relief by going to the bathroom. So that's a kind of a picture of, this is a remedy that should come to mind when you have a cold or flu. It's gelsemium. It's the jasmine flower, which we have a lot of here in North Carolina. Just a gorgeous plant and smells beautiful. Slide number 11. Influenza normally starts with an achy body and progresses to fever with chills, coughs, and headaches. Influenza can range from mild to severe depending on, and it says, immunization to the virus, allowing some people to return to work and or to school in just a few days. So one thing I'm going to say is, if you're sick, stay home. You do not want to spread this. You do not want to make yourself go out and do something when you know you can be affecting other people. Slide number 12. What are other life stressors that you might have? I have a whole long list here. Processed food, smoking we mentioned, alcohol, which taxes your liver, bad news, that reduces your emotional sensibility. Sugar, we know, is one of the worst things that you can be having, processed sugar, even though honey is a really good healer. Chronic pain, meaning that when you have aches and pains all the time, you're constantly dealing with that, and it's a stress on the body. Physical strain. Lack of sleep is a big one. It's prevalent all over the world. Negative thinking. Cold weather, we're going to highlight that one, and the lack of sunlight. So what do we know about influenza? It's seasonal. It comes every year. It comes during the cold, dark season of winter, in fall and winter. So, and then it kind of goes in the springtime. So those are the times of the year when we have less sunlight, less making of the vitamin D, and one of the things I'm going to talk about is the cold. The cold stresses us, especially in our nose, in the nasal passages. That's another reason to do the pranayama breathing, to warm up the nasal passages and get our immune system functioning, where we contract disease through our mucous membranes. Number 13, do you have a comment? Do you want? Okay, is there something really important that we want to talk about? I want to thank Dr. Kaur and Dr. Sharma. Kavitha notes tuberculinum and baxillinum are very helpful for chronic colds and allergies. Excellent. That's a great tip that I did not mention or put in the slides at all. Michelle said, people develop pneumonia after being in the hospital, especially for lung issues. There's not enough air movement and body movement, and definitely poor hospital food. Someday they're going to change that. They're not going to just give you Jell-O and tons of corn syrup in every single bite that you or drink that you get. So slide number 11 and number 13, and I want to make this perfectly clear. In an emergency, you play it safe. Don't delay to call, this is slide 13, don't delay to call physician or go to the hospital with severe symptoms. Yes, I have heard that a child, an adult child, was caring for a parent, and 1 week the parent is in bed sick with the flu, and this patient is moaning and moaning and moaning, and a week passes, and then they go to check on mom, and she's lying there dead. And this is a true story. The reason, and this is not to instill fear, this is to instill action when it is needed. When you're caring for somebody who's sick and you see that their progress is not improving, then you need to take them to see the physician and go to the hospital and get care, whether it's blood or whatever it is that they need. Cleanliness is number 14. Proper hand washing. Use soap, not bacterial soap, and that because that causes more germs to become resistant. I want you to self-quarantine yourself, and they tell you to cough into your sleeve. If you got a tissue, hey, use it. I'm going to show you one of the little things that I have next to my sink, and that is a brush. I keep this brush right there in the dish with the soap so that I can scrub my nails, my fingers, my hands, and do a good 2 minutes, sing the song Happy Birthday a couple times, do a good washing and rinse, and you'll be fine. And make sure that when you're going places that you recognize that people around you have been coughing and sneezing. You don't, we are so unaware of how many times a day we just touch our face, touch our nose, touch our lips. And if you've been around something, this is how the germs spread. So just be mindful of that, and remember to keep your hands down and use the soap and the water. That's all you need to do. Slide 15, vitamin D. It's important that, as I mentioned before, we have adequate amounts of vitamin D, and it has been shown to deactivate the flu virus in human subjects by 3 different independent research groups. And there is right there at the bottom of that page a link to great detailed information about vitamin D. And I take a liquid drop of vitamin D3 myself every day, lots of units. And here it recommends on this website 4,000 IUs of liquid vitamin D per day for women. And I can't believe it said 5,000 IU for international units for men, and a teaspoon of A and D formula for kids. That's what it says on the website.
So,
Yeah.
liquid is different than taking a pill of 5,000 units?
I don't know whether it's any different. It's just the formulation. It's the brand that you get.
Okay,
And yeah,
'cause I take pills.
you take pills.
So this is the liquid. It just happens to be on the website like that.
It says liquid,
Okay,
and
okay.
I take liquid, and I think that you want to be sure that you're getting a reputable brand. Okay, that's the important thing. Vitamin C. Vitamin C in the common cold, and if you go on the website of orthomolecular.org, which is all about high potencies of vitamins, and especially vitamin C. Linus Pauling, a great scientist and physician, Nobel Prize winner, explained that vitamin C taken at the proper dose can prevent a virus from taking hold in the body. That's another vitamin that I personally take daily. It says here 2,000 to 3,000 milligrams of vitamin C every few hours or until you reach bowel tolerance. And I tell you, yes, thank you, Gabrielle Seelman. She's got it up there too. She says 2,000 IU a day in 4 portions. And I have read stories of people who were really very, very ill with the flu, what they did was they took every like 15 minutes or every hour, they took 2,000 milligrams. Yes.
Yeah, because you pee it.
Well, yeah,
if your body doesn't need it, it just comes out.
yes, and they were better immediately. They were better immediately. So more stories like that would be great.
Dr. Reguar says there are substitutes for vitamin
And D
D
in the cell salts. Okay, well, I think that there are probably homeopathic cell salts that are very helpful, but this is a tried and true medical fact. So that's why I go with the vitamin D, D3. And it's part of the reason is because we're so lacking in our body. If you don't have the sunlight, if you're covered up all the time, if your body's not making it, then we're actually missing it. And it's the same thing like people who would get scurvy, they were lacking vitamin C, and therefore they needed the lemon. So we need the vitamin D today. Okay, Gabby is giving us good information. She says, take it 4 hours before sleeping. In other words, you don't want to be taking it that keeps you awake at night. Slide number 17. Vitamin C is required for an adequate immune response in limiting lung pathology after influenza virus infection. This is another research article on the NIH, the National Institutes of Health. I have a link for you there to read further about that. But you know, the doctors, the researchers, everybody is really into vitamin C today, and there's a good reason for it. And they're doing studies to kind of, you know, like back up with some kind of clinical trials or proof that this really does make a big difference for your life, and they want to show you the stats on that. Okay, slide number 18. Vitamin E protects mice from pneumonia. Now, they use mice, and Amnon's thinking about these tiny little mice, and the reason is because humans and mice are really so similar, and they used in this study actual human virus in order to test. So compared to the mice that had normal amounts of vitamin E in their diet, the mice that were fed extra vitamin E had 1,000 times fewer bacteria in their lungs, 2 times fewer the number of white blood cells or neutrophils. And the reduced number of bacteria and white blood cells resulted in less lung damage in the older mice who received extra vitamin E. These mice were able to control the infection as efficiently as young mice. So, you know, I always say, are we mice or are we men? Why don't we do all these trials in humans? But, you know, sometimes they say for ethical reasons or for other reasons, you can't infect people and make them sick and then say, let's try this. Let's see if vitamin E is going to help you. And so that's why they use lab rats, mice, and things like that. And so this is important, another vitamin that can help us. Slide number 19, selenium. It's a trace mineral in our body. You will find it in grains, in Brazil nuts, a great deal, and in other foods. Selenium deficiency causes a flu virus to mutate into more dangerous forms. Scientists reported discovering that inadequate intake of selenium boosts damage caused by influenza viruses. So it's possible that in today's day and age, our food has lowered nutrition, lowered trace minerals because we have depleted our soil from the use of pesticides, glyphosate, and we've just damaged our soil. And that's why I keep coming back to the soil. We are the soil. Our earth is the soil. And why you want to eat organic foods as much as possible, because it's going to have the highest benefit for you. The plant's going to be able to uptake the minerals and the nutrients, and you're going to be able to say a blessing and put it into your mouth, and your body's going to be able to uptake the nutrition from the plants. And if we don't have it, that's why it's saying, think about selenium. And selenium is, I did a whole show a couple years back with Mark Simon, all about selenium and how he's treating men with prostate cancer and other cancers, and how important it is for all cancer patients. I have a little note here. Rodents consuming too little selenium develop significantly more harmful lung inflammation. Okay, slide number 20. We have a note. Chicken soup for the soul. So chicken soup, wow, you're not going to believe what grandma told you. I'm a grandma and I give it to my family. Chicken soup is found to fend off flu. A compound in the chicken soup called carnosine can help strengthen the body's immune system to fight off flu in its early stages. I'm also taking extra supplement of carnosine, L-carnosine. And in the 1993 edition of Chest, it's a medical journal, it says that chicken soup had a mild anti-inflammatory effect that reduced symptoms of upper respiratory tract infection. And I have there the link to a full article about chicken soup. Yes?
Is this the chicken soup that we would buy in a can in the store, or one that you know
Homemade?
how to fix? Yeah.
Okay, so
or the same. Are they the same?
You're going to be in shock. At least I was really surprised.
Okay.
No matter what kind of chicken soup it is,
Yeah.
even though you think Mama's is best, because I put in all parsley and garlic and onions and carrots and celery and all good things that you can want and know is wholesome and good for you, but the canned soup works too.
Okay.
I was really surprised. And Gabrielle says, cook it yourself, no fast food, and include, and I do this too, I will put in a whole thing of onion with the skin. She says put the skin in and the garlic with the skin, and it's really, really powerful because we know that they do have antimicrobial, antibacterial properties. Chicken soup number 21. Organic bone broth helps heal the guts. So what this article says, this is the Douglas report, says that it's not all of the greens that we put in. He says it's the bones and the cartilage and the marrow, and it unlocks the gelatin and the essential nutrients and trace minerals that can boost the immune system. When you're cooking your chicken soup at home, let it simmer all day and do not boil. So use a lot of water and keep it on a low light and let it simmer and draw out until the bones are really soft. That's what he's telling us, okay? And that was from an article in the journal, medical journal called Chest in 2000. Dr. Stephen Renard of the University of Nebraska Medical Center in Omaha tells us this. Okay, slide number 22. Soup reduces cold symptoms. Research showed that soup inhibited the movement of the neutrophils. Remember those white blood cells that we talked about that defends against infection? Dr. Renard theorizes that by inhibiting the migration of these infection-fighting cells in the body, chicken soup essentially helps reduce upper respiratory cold symptoms. So what the chicken soup is doing is providing us the warmth, the moisture, the comfort, and the movement of the cilia in the nose. It's moving the fluids that are the passageways to drain out the germs. Something's funny?
Yeah, Dr. Bob says only eat a vegetarian chicken.
Vegetarian chicken. Can we get that? Well, we can get a chicken that only eats vegetarian. Okay, slide number 23. Soup reduces your cold symptoms, which I'm explaining. The hot fluid helps to increase the movement of the nasal mucus, but the chicken soup did a better job than even hot water. So there was a study where they compared people just taking chicken soup, which is the aspect of the moisture, the fluid, hot water, to chicken soup. Chicken soup works. It improves the function of the protective cilia, the tiny hair-like projections in the nose that prevent contagions from entering the body, according to a 1998 Coping with Allergies and Asthma report. And this is from a huge article on the New York Times. Okay, so Take your chicken soup, your vitamins, your meditation, your breathing, all of that good stuff. And now, don't panic. And I'm going to give you this information from Dr. Paul Herskew, our fabulous homeopath, well-known physician, who has been doing years of study about epidemic disease in the world. And he has a couple of websites that you can go to, paulherskewepidemics.blogspot.com and herskewlaboratoryflu.org, where he monitors people who input, homeopaths input the patient that they see and what the symptoms are for that year, so that he can figure what is most common, what is the most common symptoms, and what remedies are actually working if you take all of us as humanity, as one living organism, all of the population, as if we are one, as if we are connected, not just this person needs this. It's not the typical individualized medicine. This is the homeopathy of genus epidemicus, where we are looking at an epidemic disease that affects everybody across the board. And it might affect us in a little different way. You might be sneezing and I might be coughing. You might be having chills and I might be sweating. So it depends on the whole totality of the picture and putting together all of these clues. So guess what he says for 2015? Lycopodium, club moss. Quote, "This is regardless of the actual bug. I have seen the very young with right-sided otitis media, teenagers with right-sided sore throats, middle-aged people with bronchitis and influenza, and older folks with bronchitis. In each case, the patient was either someone who needed Lycopodium constitutionally and got sick while staying in their constitution, or else someone who went into a Lycopodium acute state." Okay, you got that? Keep it on your shelf. Slide number 25. Continuing with Lycopodium, what are the typical symptoms that we see in a person who might benefit from this homeopathic remedy? Bloating in the abdomen, indigestion, they have a hard time digesting their food. They're hungry, but as soon as they put a couple of bites into their mouth, they say, "I'm full." The throat and stomach feels full. Digestion is impaired. It's very sluggish. It's noisy. There's rumbling. There's gurgling. And this person might be prone to having gallstones. There's distension of the abdomen from gases that when you say, well, if you have some flatulence, if you're farting, does that make you feel better? Sometimes people say it doesn't do a darn bit of difference for me, but for them it relieves the feeling of bloating for them. There's aching in the kidney region before and after urination. There's a tickling cough. You know that they constantly have that tickling cough, and it's overpowering in the evening before they go to sleep, which makes it difficult for them to lie down. Strep throat that begins with pains on the right side of the throat and then go to the left and then back again. Pains are worse between 4 p.m. and 8 p.m. after sleeping and with cold drinks. So these are keynotes that any homeopath might know about the remedy Lycopodium, that it usually begins and is worse on the right side, and then it might move to the left side. And also time of day, they feel, what is your most sluggish, worst time of day? You need to go for a nap at between 4 and 8 p.m. Okay, slide 26. What about this year's flu? The CDC says that the vaccine is 23% effective for the predominant H3N2 virus, which is the one floating around today. The CDC would like to see the vaccine be between 40 and 60% effective, but that's not what's happening. So you're going to ask yourself, do I need to take the flu vaccine? I've read a lot of websites that are saying people are not getting the flu vaccine in the numbers that they predicted. They may have 30 million doses stockpiled, but they got them stockpiled because few people are taking it. Once the agency realized that the current flu vaccine was a poor match to the circulating H3N2 virus strain, it was already too late to change it because they need a lot of time to prepare that immunization. The CDC epidemiologist Alicia Fry, MD, was shown saying, if we look over the course of time that we've been monitoring vaccine effectiveness can range from 10% to 60%. Okay, slide 27. A systematic review of 51 studies involving 260,000 children ages 6 to 23 months was published in the Cochrane Database Systematic Reviews in 2006 and found no evidence that the flu shot was any more effective than your placebo in children under 2 years of age. And I have a link down there to the NIH article where that came from, Vaccines for Preventing Influenza in Healthy Children. And so this is really a childhood study. And basically, you can read the notes there. It is the flu vaccine, or any vaccine, supposedly is effective from the age of 2 years old, when a child is beginning to develop their immune system. But under that age, you're just injecting all sorts of toxins and other things, germs, into the body. And a child who's 6 months or below, or 2 years and below, it's really not going to be that effective. It's just going to kind of stress the immune system. I do have a note somewhere that I'd like to pull up, that I was having a chat with Jenny Tree this morning on Facebook, and she said, I asked her, what's happening in London? What's happening in Britain? She said they did a mass vaccination of school kids, very young ones, with the nasal spray. I think that's the Tamiflu. For a start, kids don't get the flu, and seldom anyway. And that's actually true, because it's more the elderly who are getting the flu today in this season. So what was the purpose? She says to protect the elderly. Well, so you think this has produced this is her idea. Has it produced a flu miasm? Are we kind of, by vaccinating annually, causing humanity to have now this alert, high sensitivities tendency to get the flu? I'm not sure whether that is true or not in society, but what's happened is it kind of makes humans dependent on taking the vaccine if they get it every year.
But they can also say that, you see, we vaccinated the kids and not many of them got it.
That's true. Okay. In turn, there have been what they call, quote unquote, major incidents, says Jenny Tree, in many hospitals. These are not incidents in the least, in the correct use of the word. The hospitals are short of beds, as too many old people have the flu because of the flu vaccine. And I can tell you, I have spoken to many people, there are hospital workers, people who work in the industry. They get the flu vaccine and immediately they come down with all the symptoms of flu. So you want to get the flu symptoms from the shot or from the natural method? And that may not be, you may not get the flu naturally. And I'm going to get to what are the benefits of getting the flu too. Okay, Dr. Wakar is asking about medicine. What medicine is he asking about? Maybe you can field that question for me.
Karina said I do.
Homeoprophylaxis. Okay. Homeoprophylaxis is when you do preventative homeopathic remedies in flu season. So gelsemium might be one of the homeoprophylaxis, just because it's reducing your fear factor and calming your nerves and making you less stressed out. Another could be acylcoccinum, which is the bird remedy from the liver of the bird, which is the transmission of flu, bird flu. And I see here influenzinum is also listed, and I've got that in the slides too, and vaccilinum. Okay, we're going to slide 28. When to question taking the flu shot. A severe allergy, if you have a severe allergy to chicken eggs, because the Tamiflu has the chicken eggs, some newer vaccines may not be using the eggs, the chicken eggs, as a medium. If you have a history of severe reaction to the flu vaccination in the past, think twice about it. Why do it again? A moderate to severe illness with fever, you should wait until you're better. You don't want to doubly stress your system. So when you go to the doctor for a checkup, they're going to ask you, okay, you got an ear infection, you want the flu vaccine? Well, you might say no in that case too. And then also, if you've had a history of Guillain-Barré syndrome, which is a severe paralytic illness, GBS, which in 1976, I believe, there was a big uproar about that because people left and right were coming down with this from getting the flu vaccine. And there is a link to the NIH publication there. Oh, maybe I just stuck it on the bottom. Don't I get the vaccine? Take a close look at your personal risks versus the benefits and possibility of contracting flu. If you do get a flu strain naturally, you're going to have lifetime immunity. So you're not going to be dependent on that vaccine. Every time that strain comes around, like the bird flu, people our age didn't get the flu in that season simply because we, as young children, had already had the flu and had natural immunity for the rest of our life. And if you take a vaccine, it's going to give you short-lived protection. And remember that it only lasts, that you have to wait for it to act. And it, like this year's flu vaccine, it's not specific to the strain that is prominent. If you get the vaccine, you may make your system dependent on shots, even if the shot is ineffective. And you must wait 2 weeks for the injection to become effective anyway. You know, over time, viruses can mutate in just a week. So let's say you get the immunization, and next week, that virus is already changed. Whereas homeopathically, we look at what's called similars. It doesn't have to be an exact match. It can just be similar to the symptoms that you're expressing. On slide number 30, we have the story from Heidi Stevenson, who passed last year. Was in honor of her memory. I posted this, vaccinated versus unvaccinated. Flu vaccine causes 5.5 times more respiratory infections in Hong Kong. This is a true double-blind placebo-controlled trial of the flu vaccine using saline solution, a genuinely inactive placebo, against the trivalent flu inoculation. Typically, when they do studies, and there's a link down there to more information if you want to read a more thorough analysis of that. Typically, when they do a study, a clinical trial, they might be comparing a flu vaccine to another flu vaccine or something that has already tons of ingredients, toxins, preservatives, adjuvants. It might already have aluminum and MSG and other things in it. So where is the true comparison between the vaccinated and the unvaccinated? That's what this study in Hong Kong did. It said you are taking people who have not had any inoculation at all except for saline, which is a true placebo. So I think that's really something that we need to look at more. Slide 31, this is what folks on the chat were talking about. Influenzinum and acylcarnitine, the homeopathic remedies. The only homeopathic flu product is influenzinum, which is updated each year based on the various flu strains predicted by the WHO, World Health Organization. Now, what difference does it make? Because they didn't predict the correct strain. So whether it makes a difference with the influenzainum or the flu shot, I don't think it makes a difference. Influenzainum is especially formulated to stimulate the body's own defense system to resist the onset of seasonal flu strains, shown year after year to be highly effective to prevent the flu. And I don't really mention Oscillo specifically, but it is made from the bird liver, which is the contagious vector for bird flu. So it's really good if you feel yourself coming down with the fever and chills and malaise and all that stuff. A lot of people take it homeoprophylactically every week, a month in advance. Jana says, what about the dangers of the preservatives and heavy metals? Why endanger yourself? I have treated many who got sick after the shot anyway. That's absolutely true. And, you know, it is dangerous to be taking the vaccine, but today's show, we're not going to delve into that. You listen to Alan Phillips, and he talks about it every single week and really has good facts and current events news about the people. What did I just see on Facebook? There was a young girl who died immediately after getting the flu vaccine, and Dr. Tony Bark, pediatrician, MD, said that actually every week people are dying after the flu shot. Slide number 32 is just giving you a big link. This is a link to a prior Blog Talk Radio show that I did with Phyllis Georgic, and she talked about how to protect yourself from cold and flu with a listing of lots of different homeopathic remedies. Actually, we how much time do we have?
It's 11, so we have half an hour.
Okay, so I think we have time to go through some of these remedies. And I want to thank Kathy, Kate, Manfred, waving hello, Fairy Mom, Dr. Shweta, and all the other folks who've come into the chat for posting and talking and letting me know what your thoughts are and talking to each other. So the first remedy I have listed here is aconite. I really power-packed today's show.
Hello, Debbie. I want to mention one thing, that the homeopathy is working very well on the, as you mentioned in the slide number 12.
Slide number 12.
The causation of the flu, in which you mentioned the bad news, PTSD, and the negative thinking. And in these cases, when the causative factors are the bad news and the negative thinking, the homeopathy works very well.
Excellent. Because it's not the physical system that is down.
Yeah.
It is the emotional system that is stressed. So if we pick ourselves up and think positively and do what we need to do, we might contract the flu, but hopefully it would be short-lived and a mild case, and it's just a short-lived acute illness, not something that's going to move into a secondary infection. Thank you so much for that comment. Okay,
Thank you.
If you have anything else to tell us, please, you are welcome to jump in here at any time. Okay.
Yes, definitely.
So the first remedy that I am showing, and I don't have listed all the remedies for flu because I don't mention Rhus toxicondrin and some other ones, but let's start with aconite. Slide number 33. Slide number 33 is on aconite, and moms might typically think about aconite, spongia, hepersulf as a triad of 3 remedies for contracting an illness after being out in a cold wind, suddenly getting chilled. And so that's, you're thinking about wintertime, the temperature is changing, the climate is changing. So there is a sudden onset, usually in the evening, often after this exposure to cold weather or dry weather, cold winds, either one or both. it's the very beginning of illness. So we typically think of this as initially, what is the first remedy I'm going to do? Within the first 24 hours, this might just cut your illness short right after that. There is the fearfulness, but it's a different kind of fearfulness than the anxiety and anticipation of gelsemium. We're going to see a high fever spike up, something like maybe belladonna, and restlessness, sensitivity to light, thirsty person. There's watery, runny nose with sneezing. So typically, the nose is so important as our protection, as our barrier, where the germs are going to come in and try to infect us. And so the body is sneezing like mad and trying to get that runny nose and that mucus going to try and drain it out of the body. The body knows what it's doing. These are for the early stages of croup as well. Dr. Wakar is asking what medicine after influenza and weakness. And I didn't mention that, and it's not up on here, but we typically think that after there's a lot of loss of fluid and weakness and fatigue, we think of China officinalis. And Dr. Sharma, did you have anything else for weakness and fatigue after flu?
Yes, definitely. After flu, because the maximum time patient is coming to taking with the allopathic medicine, so I am using the Nux vomica. There is a medicine that works very well. And if the patient is not taking any kind of allopathic medicine, then the medicine, maybe the China is a good, or the Veratrum album is also a good remedy.
Mm-hmm. Okay, yeah, I just messaged my son to get that Nux vomica right away because he said he was sneezing, and he's working in the hospital with all of these flu patients. So, and he also had
Yes.
and as a person in employment in a medical situation, he's required to get the vaccine every season. He gets it every season. He gets sick immediately after getting that vaccine. So, okay, slide number 34. Arsenicum album. Arsenicum album has profuse watery nasal discharge that burns the skin. So, that's a keynote of arsenicum is burning sensation. The nose feels stopped up. There's irritation and tickling in the nose. Frequent and violent sneezing. So like Nux vomica, like aconite, it has sneezing. Nasal discharge may be thick and yellow, which we think of thick and yellow for pulsatilla, but their discharge is bland, while the arsenicum album patient might need for the burning sensation. Dull throbbing frontal headache, cough from a tickle in the larynx or from deep in the chest. The cough might be loose or dry, and there's burning. Remember that burning sensation in the chest. This person who needs arsenicum is a very chilly, cold person, anxious and restless and highly fearful. Okay, so thinking about fearful of death. And I didn't mention in the aconite, they might predict the time of death. They say, I'm going to die. I'm going to die. I can see that. And arsenicum album is going to die too, but they want somebody to cuddle them and be with them, and they want company. They don't want to be alone. Next slide is belladonna. This is another one that's at the beginning of cold or flu, sudden onset, high fever, a dry, flushed, hot face. You're not looking at a person who's sweating. It's very dry. The skin is dry, even if they have a high fever. The pupils are dilated, and you might see a strawberry tongue. I usually think of a strawberry tongue for the pulsatilla type, but it looks like strawberry tongue is written here for belladonna as well. Mentally, they're dull but unusually sensitive to light, odor, and noise. So highly sensitive, which I think about Nux vomica being sensitive also. Anxious, there's a throat that is raw and sore. We know as a genus epidemicus, belladonna has always been helpful for strep throat. You're going to have a very painful headache or an earache with throbbing pain. So throbbing pain is a keynote. Pulsating pain is a keynote. I believe belladonna is right-sided pains. And there's painful barking and short cough. There we go. And I think I cut off the notes, producing a thin, it must be watery discharge. I'm guessing. Okay. Slide number 36. Did you have anything else to add to the belladonna, Dr. Deepak Sharma?
Yes, you can identify the belladonna by seeing his face with the redness, or the face is like the blushing.
Okay.
That is the main feature you can find out by the observation only.
Okay. And Gabrielle Seelman in the chat is calling out the remedy Kali muriaticum. Kali mur, I always think about using for clearing the eustachian tubes, clearing the ears so that you can swallow and you don't have a stuffed feeling in your ears. And it's probably helpful as a cell salt, maybe as a high potency also. Okay, next up is bryonia. When the cold has moved into the chest, there's a dry, painful, spasmodic cough. It's worse with deep breathing. So because you're inhaling and expanding the rib cage, it's hard for the bryonia person to have any movement in the body. So just breathing is really hard for them to do. Eating and drinking, because they're swallowing, blinking, anything that they do is movement. It's hard to do, and they have in warm rooms and during the day, so they're worse during the day. Better from the open air or from a swallow of warm water. It appears they like warmth. The pain is worse with any movement. They're very, very thirsty. They drink, guzzle water. They in large gulps. That's what they do, as opposed to arsenicum album, which is going to do a small, tiny little sip of water. They're irritable. They want to be left alone, and they really look sick and tired and heavy, dusky and dark skin color. So you might be comparing bryonia to the DDD of the gelsemium, although you're going to see a big difference, I think, from irritability. Slide number 37. I see in the chat, Rochelle is saying causticum, sips of cold water relieves the cough. Thank you very much. Yeah, causticum is another great remedy. Gabrielle talks about spongia for a deep barking cough. And so does Dr. Ricard. Slide number 37 is Eupatorium perfilatum. There's a deep ache of the back and limbs. So this is a typical flu remedy because the body aches and pains. The eyeballs feel like they're bursting. The eyeballs are sore. You're afraid to move because of the pain. Again, very thirsty, and then you're going to have chills and fever. There's going to be vomiting, which might follow the drinking of the water, and there's great weakness. I don't think people are looking too good when they need the eupatorium. That's the bones, you've ever had that. It's pretty bad. Do you have anything to add to that one, Dr. Sharma?
No,
Okay.
nothing.
Okay. Slide number 38, mercurius. The cold begins with creeping chilliness, violent sneezing. Hey, the body knows what to do. There's a lot of sneezing. Thick, green, and profuse watery nasal discharge, making the nose and the upper lip sore. Have you ever seen anybody who looks like that? It's completely red. It just you just want to put on some Vaseline. You just want to soothe them with calendula or do something to make that rawness go away. There's a raw sore throat and difficulty swallowing. Yes, very difficult swallowing. There's this coated, heavy tongue. So if you say, stick out your tongue, let me see what that looks like, and you see this great big thick white coating on it, you're looking at probably mercurius as a helpful remedy. There's a lot of salivation, so at night they're having such a horrible time at night. It's the worst hours for them. that the saliva is just dripping onto their pillow. They have a bad mouth odor and tickling in the ears. It's supposed to be tickling, I think. And they're very thirsty also, weak, and they're trembling. The whole person really smells sick, and they have a hard time to lie on the right side. They're worse in wet and damp weather. These people have a lot of perspiration. So it seems like this is pretty obvious. If they're going to need mercurius, they're going to walk in the room, you're going to see from the perspiration and the odor and what they look like. What have we got here? They're talking in the chat. They're pathetic, apathetic, and withdrawn. Okay, very good. Slide number 39. Here we come with Nux vomica. This is Dr. Sharma's favorite remedy. Maybe, I don't know, is this your favorite remedy this flu season or every flu season? Is he there? He might have walked out for a second. So what happens with Nux vomica? These people, they love wine, they're connoisseurs, they're workaholics, they're go-getters, they're really moving and shaking people, but they're very sensitive to their surroundings. And the exposure to the cold, dry weather, dry, tickling, and scraping sensations in the nose. They have a stuffy nose, typically at night, and dry. It's dry at first, and then it develops a watery and irritating discharge with the sneezing. The nose may alternate between stuffed up and at night and runny during the day. That's kind of what it says out here. Runniness in warm rooms and during the day. Throat is raw and rough. Tickle in the larynx. It kind of sounds a little bit like some of the other remedies we've been talking about. Teasing dry cough leads to soreness in the chest. So you're talking about that upper respiratory cold that drops into the chest like a bryonia. The cough is worse in the morning, especially when they wake up. And at 12 a.m., that's at night, they can't sleep, they can't lie down to dawn. It's worse after they're eating and when they have mental work, because they're prone to mental work. They're workaholics. They're using their mind all the time, and it's probably difficult for them to think. And it's also worse due to the atmosphere, the cold air. The cough, this is a cough where they might end up gagging and retching. For them, it says warm drinks relieve, and that's the same as lycopodium. They really love hot food and warm drinks. Nux, it seems, also likes the warm drinks because they are like Arsenicum album. They're very chilly. They're unable to get warm despite piles of covers. And so you'll see them bundled up in bed, all covered up with, put another blanket on. Every little motion causes chills and they're irritable. They're easily offended. Yeah, these people, don't tick them off. And they're extremely sensitive to noises and to odors. Better with the warmth in the evening, lying down, and if they get a nap. So don't wake them up in the middle of a nap because you're going to get barked at. Any other comments? Let's see.
Yeah, and for the next vomica, you can say any symptom related with the indigestion or the gastric complaints is equal to the nux vomica.
Thank you very much for pointing that out, because I was just talking to a nurse and she said, everybody, I hope you didn't get the flu, the digestive flu, because there's probably people who are having bowel symptoms, indigestion and diarrhea and things as well with the flu. And so that is another component, a way of looking at flu. Phosphorus. This is a beautiful mineral remedy for people who are very, very friendly. They really care about their friends. And it's also for the blood. It helps support the blood. It's for people who are bleed easily, red, bright red bleeding. So here we have laryngitis and hoarseness, violent tickling in the throat when they're speaking, worse in the morning or in the evening, a cough that is dry or loose, a croupy cough that might be deep. So you hear somebody do that, take a deep breath in and do that deep cough that sounds like a lot of fluid moving around. It increases when they're talking, eating, laughing, or breathing cold air. The cough is worse lying down. You know, that's kind of like that tickling cough of Nux. They're better lying down and sleeping, but they also have a trouble to sleep because of the cough. And for them, the cough is worse when they're on the left side. So you pay attention and see if the person's lying there and sleeping on the right side. That's the most comfortable side. Maybe phosphorus will be helpful. The cough is aggravated by liquids, especially cold drinks. And we know about phosphorus that if they drink cold drinks, put ice please into the cup. And after they drink, as that fluid warms up, they're going to want to vomit it out, unfortunately, because it's turned warm once it's in the body. So they like the cold drinks. Phlegm of any cold or color or consistency. And here we're mentioning streaked with blood because blood is a keynote for phosphorus. They have chest pains, worse on motion, which is similar to bryonia, better from pressure, which is also similar to bryonia, the sensation of tightness or constriction or of a weight in the chest. These people are very chilly, but they crave ice. Interesting, isn't it? You'd think that they would want to warm up. And they're nervous when they are alone or in the dark. So like for little kids who need phosphorus, they want to sleep with their mommy or daddy. They might have some fears in the dark. Do you have anything to add to phosphorus?
Actually, I have no experience with the phosphorus in
Oh,
the flu,
okay.
but I really uh, exciting about know about the phosphorus in the flu, so I will use it definitely.
If you see it. You know, like let's say somebody
Yes,
blows their nose and there's blood, you know, because they've damaged the capillaries. The little blood vessels are just so tender. And so that might be a good remedy for
yes,
them.
but for that I am using the Hypersulf.
Hepersulf. Okay. So I didn't put
Yes,
Hepersulf in here, but it was one of the triads, aconite, spongia, and Hepersulf. And Hepersulf is really, really good for people who are very sensitive to cold drafts. So if they have an open window next to their bed, you better close it because they're going to be irritable as all get out. They're going to be miserable. And it's going to cause that sharp, sticking pains in the throat. You have anything else to add to the Hepersulf?
yes. Hypersulf is basically a very sensitive remedy, and the main symptom is the chilliness with the cold very much, and the discharges is yellow and sometimes the greenish. Thirst is low, and the patient is always desire about to cover the head and face,
Thank you so
and
much.
sometimes the left side of nostril having the bleeding with
Okay.
the discharges in the hip itself.
Excellent, excellent. So Hepersulf is great for croup, ear infection, bronchitis, any kind of infection actually, and because you're going to see the yellow and green discharge. So we're going to move on to, I think, if you really have a very bad infection, sepsis, you're going to think about something like pyrogen, but we don't have that listed here. We're going to move on to pulsatilla. Okay, we mentioned pulsatilla earlier. I see that Gabrielle Seelman is mentioning it. She also said that she had a flu that she took phosphorus for. And she says the fever, there's boiling blood, anger about something. Very interesting. Okay, pulsatilla. This is that thick, creamy, bland, yellow to yellow-green nasal discharge, which I guess is similar to Hepersulf. They are like companions, with stuffiness alternating with fluent discharge, which is also like the Nux vomica. So here are your differentials between the different remedies. The nose may run in the open air in the evening and stuff up in a warm room. So although Hepersolf cannot stand having the cold draft, or the warm air, you better open the window for the pulsatilla moody patient. This person, whether it's female or male, likes to have open air, and maybe go sit outside on the front step with them, and their mood will perk up a little bit. Let's see. It says the lips are chapped and peeling. They have a dry mouth with a lack of thirst. This is a keynote. So as opposed to all the other remedies that we read, like Bryonia, that are very thirsty, or some of the others, this one, the person says, I'm not thirsty, I don't want to drink. Both dry or loose cough, and they may be dry in the evening and loose in the morning. So, like that trying to cough, that dry cough at night, but then in the morning there's some mucus and phlegm that they're able to, you hear that rattling around. I didn't mention like that. The really rattling cough, we're going to think about Antimonium tartaricum, but that's also not in this particular set of remedies listed today. There's a sensation of a weight on the chest. There's coughing spasms that may end in gagging or vomiting. Do you remember the other remedy that had that? I mentioned it. It's Nux vomica. It's cough worse, and so we think about pulsatilla and Nux vomica as like brother and sister. The cough is worse when lying down with exertion or warm room. It's better in the open air. There's red, swollen external ear. Oh, that's an interesting point. So you might see the ear looking flushed with an earache. So we think about pulsatilla for young children with earaches very often, and they like a lot of comfort. There's severe throbbing pain, which is similar to belladonna, and it's worse at night, which is similar to mercurius. It feels as if the ears are stopped up. The person is weepy, they want attention, they want to be held, they want sympathy. They're feeling useless to do anything to feel better. So that's kind of like a state of hopelessness, and they really crave the cold air. Slide number 40. Oh, we're almost to the end. We got plenty to okay, Rumix crispus. There was a post somewhere on Facebook about 2 days ago. I think it was, I'll have to look it up, but Rumix crispus was the answer to the question, and I thought it was a great post because they did some keynotes, and this was it. Cough provoked by breathing cold air or by minute changes in the air temperature from warm to cooler. Extremely sensitive to inhaling the cold air. You know, a person like, actually, I know somebody who is stuffed tissue papers up your nose because you just can't stand to have the air flowing into you, and you have that fluid running of drainage. There's a very, you cover your nose, and you know what? Isn't that brilliant? Because that's what it said, that it's the cold air during the cold winter flu season that's preventing the cilia from moving and doing its job properly. So keeping that nose covered and warm is a good idea. Variation in airflow might excite a cough, so the person carefully regulates breathing. There's a cough that is dry and shallow, set off by tickling in the airways or pressing the hand to the throat. The worst time of day for them is 11 p.m., where I think, Dr. Sharma, is arsenicum album worst time midnight? Or better after midnight?
Midnight from 1 to 2 a.m.
1 to 2 a.m. is worse? Okay.
Yes, for the arsenic album.
Okay, and then they're also worse lying down. Well, you can imagine, you try to go to sleep, it's 11 o'clock, and you have this all of these horrible symptoms, and you just can't sleep. They might have fluent, watery nasal discharge with sneezing, and a tough, stringy mucus that's difficult to cough up, and they have hoarseness in their throat. Now, let me tell you, we didn't mention calibichromicum. Calibichromicum is another major flu and cold remedy for, like, top dog for sinusitis. Stringy, ropey, yellow, green mucus that it just keeps coming. This is really great. Calibichromicum, which is another biochemical similar to the calimurianicum. Did you have anything else to add to that?
About the Kali group, the whole Kali group is related with the chest complaint. The Kali self is there, Kali Murodicum is there, Kali Phos is there. So every medicine have a specific action on the respiratory system in the Kali group. So I always prefer to find out the symptom of the Kali group.
Wonderful. And many years ago, I had a calicarbonicum bronchitis. So you wake at 3, 4 in the morning, cough, 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 cough. So that's also wonderful. That's another Cali group remedy.
Yes.
Um,
Yes.
Now slide 43. Again, I'm just posting a list of the remedies. Another show that I did, she gives other kinds of tips and hints about flu. It's on Homeopathy World Community in the forum area. Click forum and search for homeopathic remedies. Slide number 45. Okay, slide number 4, do you have it? This is just telling you the upcoming calendar of show. I have one scheduled for February with Fran Sheffield of Australia. I misspelled the word autism.
In 2014.
Oh, in 2014. Last year. I think you're going to go back in time. I didn't update the slide. Okay, so it's going to be for 2015 and autism. It was very late, and my dyslexia came into play here. And she's going to talk about autism. She is one of the world leaders in healing children with this problem. Slide number 40. Oh, I'm not really sure. I wanted to mention that you can see more of homeopathyworldcommunity.com and search. There's tons and tons, thousands of pages of information. There's a lot posted on Facebook, Homeopathy World Community, and I do want to mention Alan Phillips. He does vaccines and your rights. He's your legal source, your attorney for whether or not to have a vaccine of any kind and what it means to you and your family, whether you are a veteran of war, if you are a person coming into the country and required to have inoculations, whether you have children in your family who have been affected by vaccines, or your employee in the medical world. The archives are available at nissancommunications.com. Go to archives, and because
On demand.
go to on demand. Okay, the website here has changed a little bit, and so Amnon is playing 24/7.
I mean, the URL is correct, but in the menu it says on demand.
Okay, so you're going to go to on demand on the left-hand column on the major page of nissancommunications.com to find all the archives from all of the show guests from all of the years. And I want to thank Dr. Sharma for being with me today, especially because you've always been my co-host and been there to back me up.
Still is.
Thank you so much, Debbie. You are providing a very excellent knowledge about the flu and the homeopathic medicine, and I will also consider about the phosphorus.
And chicken
I
soup.
really learn about that. Thank
Okay.
you so much.
And all of our shows and background material, if you want to read stuff, is on Homeopathy World Community in the group section called Health In. I'm I'm right here today. I know that I haven't been around much, as I am planning to be around for February show, but I am considering potentially putting a hold on the shows, depending on how I am coping and dealing with life challenges and anxiety for doing these shows. I had a suggestion. Maybe other people would like to contact me via email, homeopathyworldcommunity@gmail.com. Do you want to just get on and talk with me? Just be, if I say we're going to have a show in once a month, tell me what you want to talk about. Would you prepare notes? Would you prepare a PowerPoint for me? Do you want to make it about something that's dealing with homeopathy, dealing with a health issue, or just dealing with life? I want to know if this is going to continue, that I have a support team out there who can reduce my anticipation and anxiety level of preparing these shows and getting out there and marketing it on the internet. Is it worth it for me to do them, to just talk to 100 people, 800 people? I mean, is it that important, or is it more important? And this is questions that each person has to ask themselves. What is the most important thing in their life? Do I need to just sit home and do the pranayama, breathing, walking, meditation, and self-care as the primary thing to survival? Or do I need to say, let's get out there in the world and talk to people on the internet? So these are the questions that I'm going through right now. I am sharing my humanity, as my counselor asked me to do, and questioning what is the proper choices for me to make in life. So I want to thank everybody who has been with me on the chat and listening, whether or not you have been in the chat, and for caring enough to come today. I believe that there's another show coming up at about 1 o'clock. Marilyn Shannon's she does a free-form show where she just says, hey guys, this is what I'm thinking today, and talk to me. If you feel that this is something you want to do, to just call in and talk to me. So, because for me to prepare these shows, it's a lot of work. And I don't know that I have the energy to do it. So I want to ask you if you want to be there and make it happen. Okay? So I love you all. I love Amnon and
Love you too.
Deepak and Gabrielle, Vera, Kathy, Rochelle, Kate, and Manfred. I know who you are today. You posted a phenomenal musical post on Facebook, which shows an incredible instrument where the instrumentalist plays, it looks like a harp or a violin, but there's no strings and there's no violin, but the music happens, and we need to make the music happen in the airwaves. Dr. Bob is my better half out there who loves me and cares for me. Michelle is my other truly wonderful friend who has been there tweeting for me and doing other supportive things for me and encouraging me to go forth. Kavitha, she calls me Bubby because I'm like her grandma and we care for each other so much. Dr. Wakwar is there, and he has been there since the beginning of Homeopathy World Community, helping approve members and posting really great articles that he finds people would be interested in. He just posted a new one. I don't remember what it is. Oh, it was about the heart. See, I've been working on my memory. I've been working on training my memory to think of things. And so he posted a new article about how a 12-year-old child had her heart repaired based on new technology. So new technology in medicine are miracles happening today. when they can repair body organs in this way. So thank you, Dr. Wakar. Any other things that you want to say, Amnon?
Thank you again.
Okay. I'm going to let you go on with your day, and these archives are available. Love you all. Bye-bye.
And bye-bye. Thank you.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCVVI members, The Tanya Love Show, Your Healthy Pet with Gisela DiCarlo. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals, CarolinaApparel.com, and DeltaForce.net.